Hi everybody. Oh, I just bring that up. That's better, isn't it? You can hear me. So my name is Dianne Zalitis, and I'm the clinical lead for the Pregnancy, Birth and Baby Service. Just quickly, and Pregnancy, Birth and Baby is provided by Health Direct Australia. So just a really quick snapshot of kind of who we are in the service. So Health Direct Australia is funded by the health departments in all the governments across the country to provide health services for the community over the telephone, website, digital-based services, with the intention that they're able to be informed and able to manage their own health, or to work towards that as much as possible. Pregnancy, Birth and Baby, just quickly to give you a little background on that. Again, a national service. It's funded by the Commonwealth. Began in 2010 as an action out of the National Maternity Services Plan. It's staffed by maternal child health nurses 7 days a week, 7 a.m. till midnight, and supports all Australians during pregnancy or expecting or hoping to be pregnant through to when their child is 5. And we essentially do use all available technologies to provide the service. This is just a very quick kind of busy slide to show the channels that consumers can use to access the service, and it's based around them determining kind of where their need is and how much they need. So the website has the most visits. It's where people kind of self-serve their information. We get 1 million visits a month. Half of those are from Australia, the other half are from overseas. But that's what happens when you're on the web. You can't geo-lock your stuff, but still, we're helping everybody really. And we have our phone service, video call. We also have our social media, and I'm going to be talking about our Facebook forums today and the evaluation of that. But essentially our social media presence outside of the forums is to channel direct consumers then to the website for safe, trusted information, or to talk to the nurses when that information doesn't answer their query. This is just some information, I guess, for you about the profile and what people call about. So we collect a lot of data on our service, which is very helpful, particularly for the Commonwealth, in times of wanting to tell people how good they are. So not surprisingly, most of our calls fit in with mum and baby under 6 weeks, and then 7 weeks to 12 months. But we still have quite a high psychosocial support base as well that we provide through the nurses. This slide, just over a quarter, gives you a snapshot on what the call's about. They are quite varied. While I don't have a slide, the comparison to the website's quite different. A lot of the website information is very pregnancy-based. A lot of our call information is that early parenting based support that people are looking for. I want to move quickly through that. Now, a Facebook forum. Now, I'm not going to talk a lot about how to do this and what they are. I have kind of done that before, but in a nutshell, we just use Facebook's technology, which they do tweak every now and then, but it's fairly straightforward. It's exactly the same as your page if you happen to have a Facebook page, and if you want to invite people to an event, you use their event stuff, so we do that. We run it for 60 minutes. It's live and interactive, so our nurses are in there answering questions. We have a very specific topic focus that we make quite clear through the invite, and our users stick with that. You really do need to do that, otherwise you just can't answer every question in enough time frame, really. So that's kind of in a nutshell what it is. So why did we kind of venture into social media? It's because that's just where people are. Like, the birthing age group hasn't really shifted. Predominantly it's 20 to 35-year-olds, and 80% of them are just online. And we've done a lot of research into what people's use of technology and social media for health. And, you know, most of our users are on their mobile. I know that slide says 77%. It's probably much higher. There's very, very low use of desktop-type computers. So it's anything that they can take with them, really, is what we mean by mobile. And they are very engaged digitally. They really understand how to use this space, and it's where they are. And probably the most interesting and somewhat scary statistic, or that we found from our research, is that in this age bracket, they will use social media first to find information and to validate it. So the validation is when we've told them X, Y, Z, and they'll go back to social media just to check that we're right. So they're doing that. So they are actually cross-checking in social media. So you kind of need to be in there with them to be in that discussion space and where they are. Right. Okay, so we also looked at kind of device use as well. So this is kind of really interesting information about, it's an age bracket breakdown. So I've just circled the 18 to 34 kind of group, which is your main, our main age group for pregnant and new parents. As opposed to the 70s and over. So there's some interesting data here for all different age groups, but mostly our age group for pregnancy, birth and baby they're using social network sites, instant messaging, video chat, that's where they're at. Also, interestingly, is the last, at this end, there's still quite a lot of them kind of don't know what their preference is, they're just out there, they don't really think too much about it. And then this next slide is talking about the channels that women by age use to access health information. And so I've just circled kind of the main ones because there's a lot on there. So they're on social media pages, they're using their smartphone or tablet apps, so apps within those, blogging sites and discussion forums and instant messaging. So that's where they are. There's just so much evidence there. We also did some other more broader research looking at just I guess we call them at Health Director underrepresented groups, so, but the Indigenous population called people in those groups and their behaviours and how they use online for health, the health information. So, and so this is just a couple of quotes that really kind of encapsulated some of the behaviour. So they're Googling, they're out there still searching, and the quote from the cool community, they try and manage their own health, they'll Google symptoms looking for cures, they'll talk to other people, we're kind of health professionals aren't in there yet, and then some will go to the doctor, and then if we're not sure what the doctor is telling us, we'll go back to Google. So kind of, and we health professionals kind of sit about level 3 or 4 in their choice of where they're going to go. And they'll often pick the first answer that looks appealing. So sometimes you can have people online, I guess some of the anti-vaxxer groups spring to mind in our group, they look authoritative, they look professional, you know, because of the imagery that they have and how they present themselves. And so if it looks like they might know what they're talking about, they'll follow it. Okay, good. So one of the first things I wanted to look at was kind of what do our users prefer? Do they prefer using the phone or do they prefer using social? Is there a real difference in the numbers? And there's not. With the exception of men, our fan base on our Facebook page is quite low with men, so our engagement is quite low, except for the fact that they are very highly tagged by their partners in getting them to read the information that's there. Very highly tagged, and you can just see there'll be the women will be there and all the men's names are being tagged. But we have 10% of men will be calling the phone, so that's either comfortable or a safe space. Why they're doing it, I'm not sure, but they're very much not on our social media page. But the age bracket use is not any different, which is probably not terribly a surprise. Okay, so making the leap into our Facebook forums. I put this slide up because we prior to starting this, we did a lot of thinking about, is this a safe place to be? And keeping it safe for our users, because there's lots of talks about, you know, trolls and anti-vaxxers, and it can, you know, and people being unhappy, and it will, our Facebook page, which was growing really nicely, now suddenly become this place of negative comments and people not feeling safe as they'd felt with the service. And, you know, one of the things that we really thought about was the kind of topics we would talk about. So we wouldn't talk about anything that would be really polarising, not in the first instance anyway. So we didn't, and we certainly wouldn't do anything that would open up a discussion around which is the better way to do things, whether it's how you give birth, how you feed your baby, how you get your baby to sleep, you know, all of that kind of things. Not just vaccinations. We avoided that for a little bit because we were a little bit, you know, nervous. Okay, so this is a slide of all of the forums that we've done to date, and it might be a little bit tricky to read, but starting from the left, it's our first, and running all the way through. Now, there are two colours on the slide, the reach in blue total and the reach in live. So Facebook allow you to do quite a number of things within the data that they collect. So this is the data that you can get off the Facebook page. And so the orange line is the number of people who are actually there for a forum live in that hour. The blue column is the number of people that we reached over 2 days, over 48 hours. So our first forum, we had a little over 160 people in the hour, and we reached 929 in 48 hours. So we were pretty ecstatic about that, really, considering that we had 1 hour, 2 nurses, and over 2 days, that time we managed to reach just under 1,000 people. It fluctuates immensely based on the topic, but it's always stayed exceptionally good. The other data that we collect is kind of the engagement activity, what people actually do on the posts. The green line indicates some of the clicks on links, so we always have links through to our web page and information for people. But what actually happens on the post, so we get commentary, so you can see that kind of thing, the reactions on the post, what people are saying. And so you can see, again, some of that interaction coming back from people. So the next thing we wanted to do after we've been running these for a while was actually do a qualitative survey. So all of this data is what's actually happening there, but we haven't. And people are asking us questions and we're answering them. So in the forum at the time, yes, it's working. But what do people really think? And over all of our service with pregnancy, birth and baby, we do satisfaction surveys. So we took that survey, modified the questions for the Facebook forum, and then just invited people through Facebook to answer it. So, yep, that's readable up there. I wasn't sure about the white on green. And just, their participation, their satisfaction levels, why they came to a forum, what would they do, their confidence levels, things like that, so we can compare this. So this is just kind of early days, but some of the information that we have for you. So why they came, and we find that we get quite a bit of this type of feedback, that they're there just to read and hear what other people are asking. We have a lot of people who will just sit and watch and see what other people are asking, and to gather information along the way. Our satisfaction levels, we're actually really very happy with these data. So extremely satisfied and somewhat satisfied. So sitting up around that 87%, which is very, very good. And why, we asked people why they actually said that. And these are some of the reasons. So they get good practical information. The middle quote, if someone asks us a question in the forum that sounds like you want to go back and forth and get into a deeper conversation with them, we advise them to call the nurses, and they do call them straight away. So we take people off out of that if it's getting too in-depth for them and a little bit too personal, although they are very, very personal. People share amazingly, but our version of what's too personal rather than theirs, yeah, we draw the line. We also want to check on confidence levels. And while these don't necessarily look like they're really high, kind of, I guess on reflection, it's probably not something that people are asked, how do they really feel about managing their health issue or their parenting issue or what they're going to do. Our point of our service is to not breed dependence, if you like, so they have to keep coming back. But it's not, I think it's kind of a new thing for parents to be asked this question. Still, however, having 67% that are somewhat or yes in their confidence levels is very good from our perspective. And obviously everyone's going to come back. They find the forums very engaging, as those numbers are showing. I'll quickly move these. Now, what was your best experience about the forum? So what did they like? We also asked them what they didn't like, but I didn't put a slide up on that. So we kind of let them kind of tell us, what they would like to see that could be better. Privacy, and they can reread the articles and answers whenever they have the time. So the information stays within Facebook. We also have a page on our website that has a direct link through to all the forums so people can find them. And that they don't feel alone. They actually get that commentary quite a lot within the forums that, oh wow, I thought I was the only one whose baby was up and not sleeping or whatever. Some of the other kind of the impact of the forums just on our Facebook page. So within the 2 years that we've been running, we've more than doubled the numbers, and that was in January. It's actually higher than 51,000 now. It just continues to grow. Again, because it's been shown to them that it's remained really safe. And it has remained really safe. We have a really engaged group. They're very proactive. They actually moderate comments and questions. So we've had a couple of forums on colds and flus and vaccination in pregnancy. And we certainly haven't had any of the anti-vaxxers come at us in this, so that's been really good. We've had people post questions or comments, but, if I have the flu vaccine, how come I get a cold? And that that lack of understanding or information, and other parents go straight back and answer before we can get to it, and say simply, it's not really supposed to do that. You know, flu vaccine won't stop you getting a cold. That's why you got a cold. So it's different. And so there's that discussion that happens within the group, and then we'll also respond with giving them further information. And so we've had no harm, no destructive comments. And essentially the forums have evolved into becoming, I guess, one of the three pillars of the service. So we have our consumer at the centre. Each of the service aspects inform the other. So the contact centre, the type of the calls that we get a lot of calls about, what we'll often do a social media forum on, because again we can reach thousands and just have information that's there in really bite-sized snippets of information. But then again, if we're doing one of these forums and we don't have enough website content to back it up, we'll get the website content written so it is kind of circular, going backwards and forwards. There we go. And that is my contact details, the Pregnancy, Birth and Baby website link, and then off the Facebook page, which you get to the Facebook page off the website. And that is my presentation. Thank you very much.